Hello friends, and welcome to Dr. Ankur's Dental Lectures. Further to the previously discussed case vignette, we are going to talk about mandible or the lower jawbone today, which is the largest and the only movable bone of the jaw. It comprises of a horseshoe-shaped body, a vertical ramus, and an angle between the body and the ramus. The body has two surfaces, an outer surface and an inner surface, and two borders, the superior border and the inferior border. It also has many processes known as the alveolar process, into which the mandibular or the lower teeth fit in. Similarly, the ramus has two surfaces, the medial the lateral surface and the inner or medial surface, two borders, an interior border and a posterior border, and two processes, the anterior process known as the coronoid process and the posterior process known as the condylar process. The condylar process fits into the glenoid fossa of the temporal bone in the skull to form the temporomandibular joint. Further, mandible has two foramina, the two mental foramina from which the mental nerves and vessels exit, and the mandibular foramina from which the inferior alveolar nerves and vessels enter into the mandible. It has two notches, the mandibular notch between the condylar and coronoid process and an anterior coronoid notch. Mesenteric nerves and vessels are related to the mandibular notch. Now, there are two lines in the mandible. The mylohyoid line here and a very faint line here in the anterior portion, which is known as the symphysis. There are three elevations. Below the symphysis, there is the mental protuberance, and on its both sides are the mental tubercles. If we see the inner surface, there are two protuberances, the genial tubercle, this is the superior genial tubercle and the inferior genial tubercle. Also, there are three ridges in the mandible. In the outer surface, there is an external oblique ridge. Similarly, in the inner surface, there is an internal oblique ridge, and in the inner surface itself, just where the inferior alveolar nerves and vessels enter into the mandibular canal, there is another ridge which is known as lingula. Now, there are three fossae in the mandible, four fossae actually. Above the mylohyoid line is the sublingual fossa. Below the mylohyoid line is the submandibular fossa. Then anteriorly, below the incisor teeth is the incisive fossa, and finally at the lower border is the digastric fossa. So there are four fossae in the mandible. Now, if we talk about the muscle attachments to the mandible, there are five groups of muscles which attach to the mandible. First is all the muscles of mastication which help in chewing attached to the mandible. That is the masseter, which attaches to the lateral surface of the ramus of mandible. The internal pterygoid attaches to the internal surface or medial surface of the angle of the mandible. The lateral pterygoid attaches into the pterygoid fovea at the anterior portion of the condyle of the mandible, and the fourth muscle of mastication, which is the temporalis, attaches to the tip of the coronoid process and a part of its anterior border. So the four muscles of mastication attach here. Then there are some muscles of facial expression which attach here, that is the depressors of the lower lip and the angle of mouth. The mentalis here in the incisor fossa. The buccinator, which attaches opposite to the molar teeth, the lower fibers of the buccinator. So these are the muscles of facial expression which attach to the mandible. Then there are some suprahyoid muscles which attach here, most importantly in the whole of the mylohyoid, on the mylohyoid line directly or posteriorly through the pterygomandibular raphe. The digastric muscle, the two digastric muscles, the anterior valleys of both attach on to the digastric fossa. Then we have two muscles which attach to the genial tubercle. The genioglossus attaches to the superior genial tubercle and the geniohyoid to the inferior genial tubercle. So these are the suprahyoid muscles which attach. The platysma attaches to the lower border of the body of mandible, and finally the superior constrictor of pharynx attaches just behind the mylohyoid line here. Then there are four ligaments which attach to it. The lateral ligament or the temporomandibular ligament, which attaches to the lateral portion and the anterior border here of the condyle, the lateral portion of the condyle. The sphenomandibular ligament, which attaches on the lingula here. The stylomandibular ligament that attaches here right at the angle of the mandible, and the pterygomandibular raphe, which attaches to the posterior part of the mylohyoid line. So there are four ligaments which attach here. Then mandible has a direct relationship with four nerves, the inferior alveolar nerves, which enter the mandibular canal from the mandibular foramen. The mylohyoid nerve is the second. The mental nerve, which exits from the mental foramen, is the third, and the masseteric nerve, which is related to the mandibular notch, is the fourth. Mandible also lodges three salivary glands. In the sublingual fossa lies the sublingual salivary gland. The submandibular salivary gland lies in the submandibular fossa, and the parotid salivary gland encloses the posterior border of the ramus of mandible. So that is about the mandible and its anatomy. I hope you had a nice learning in this lecture.